Okay, so for pressure checking your system, you want to make sure that your pop-off valve is closed. And here for ours, we have our twist down for our pop-off, and then we also have our button here as well. So we do have to use both of them for this machine in order to properly do a pressure check. So we'll grab our tubing and plug the tubing up, and then go to our O2 flush, which is what flushes pure oxygen through the system. And you want to make sure that you never have a patient hooked up to your tubing and to your machine when you flush that through, because you don't want to send all that pressurized O2 into your patient. So we're going to go ahead and press this and fill up our bag, and we'll go to our manometer here, and we have it holding at 20 centimeters of water. And we're just gonna hold it here and make sure that it doesn't go under that and that it holds. We will squeeze our bag, which just one squeeze to make sure that it doesn't go down, and everything was holding and it was good to go. So now we can take all of that and get that done, and then make sure you always open your pop-off valve to make sure that that is secure. And I will hook up our non-rebreather system, and we will also do one of those. Okay, so for our non-rebreather system, it is kind of the same thing, except for ours sits right next to our hookup for our rebreather. So our non-rebreather, we hook up to this port right here, and I decided to do a 4.8 kilogram patient. So I chose a reservoir bag of 0.5 because the bag that I calculated was between 0.28 and 0.57. So 0.5 is just what we readily have for our machine. So we're gonna do the same thing where we go ahead and close our pop-off valve. And the other difference between with our non-rebreather too is this goes directly to our scavenge system. Which again we have through this tubing, and ours goes into the ceiling, so it doesn't go through this canister here. But doing the pressure check is the same thing, so it's going to be a little difficult like it was for pressure checking the other one, because I don't really have enough hands. But we will go ahead, and we have to hold this. We will inflate our bag, make sure that we're holding, and we're going up and holding, and we'll squeeze the bag, which again, it's a little challenging to do, just me. But everything is holding and doing well. And again, we do have our own manometer up here for this one too, that we always want to make sure is holding right where it should be with the 20 centimeters of water. And then again, always making sure, got a little stuck there, to open up your pop-off valve just to make sure that you don't have that excess pressure coming through and building up into your patient's lungs, because you don't want to pop those lungs. They're very important to breathe. And I believe that is it. So thank you. Okay, my name is Adeana, and I'm gonna go over our anesthesia machine here where I work. To start off, I don't currently have the oxygen tanks hooked up to this machine specifically, because we do have them set up in another room, but I will send in a picture of what that looks like along with that information. Our oxygen to come to our machine comes from our tubing up here. So this is what we would technically use for our O2 tank, which I know has the yoke which is on that, which then hooks up directly to the machine typically if you do have the O2 tanks, and that is just something that ensures that you are hooking up oxygen to the proper port. Then from the O2 tank to the yoke, you go to the pressure gauge typically, which is going to show you how much oxygen is left and show that your oxygen is on. And from there, you're going to go to your pressure reducing valve, which is going to control how much pressurized oxygen is then going to go through your O2 tubing, which ours is here. I don't have it connected since we aren't doing a procedure, but it does connect up into there. So you follow it through here, and then it brings you to your O2 flow meter, which right now, if I were to hook it up, we're going to start this with a rebreather I picked about like a 27 kilogram patient. So for that, here is where we would set our oxygen at to the flow that we want during surgery. So the oxygen calculation that I got would be between 0.81 to 1.35 for that patient. And so that is where we would set that. And then from the flow meter, you go to the vaporizer inlet, and this just takes you into where the oxygen goes down and helps vaporize the liquid that is in the vaporizer. And for our patients under anesthesia, that is where you set your rate, and typically the start rate is between 1.5 to 2.5% of the ISO, which is what we do use in our clinic here as well. And then from the vaporizer inlet into the precision vaporizer, you have the vaporizer outlet, which then goes through here to the reservoir bag. And I did do the calculation for a 27 kilogram patient, and the bag came to 1.62 to 3.26. So I just went with a 2 liter for this purpose. And then from the reservoir bag, you go to your negative pressure relief valve, and that is just what helps make sure that we don't have any negative pressure building up to go into the patient's lungs. So if we do have an instance where, say, your pop-off valve, which is this, which we'll go over later, is closed, there's going to be some way for that to be expelled. And then from the negative pressure relief, you're going to go to your, sorry, I was pointing at the exhalation and I meant inhalation for your negative pressure relief. But this is where it goes to your inspiratory tubing, and then which is going to be in here, this blue tubing for your rebreather, and then it's going to go through your exhalation tubing, which is just back up through here and into this portion here, which is going to be your exhalation valve. And then you go to your pop-off valve, which this I will go over at the end, just to kind of show pressure check on both machines for a rebreather and then a non-rebreather bag. And then after the pop-off valve, you go through, so for your rebreather, you will go through your CO2 absorber and your scavenge. So this is going to be your CO2 absorber with your soda lime granules in it. These will change color to purple, and sometimes will stay purple or will actually go back to this color, and it's just to show that your oxygen or your CO2 is going into here and actually being absorbed by those and not going back into the patient. And for us here, we do have a scavenge tubing that hooks also up to the ceiling. So we have a full scavenge system that takes care of that. Otherwise, what you would do is we would typically connect tubing to our little canister down there. But since ours goes into the ceiling, that's kind of where that goes. So I will go ahead and get this set up to do a pressure check, and then we will go from there.